Hello and welcome to another episode of Every Possible Angle. I'm excited for today's guest, Chris Turner. Welcome to the show, Chris.
Thank you. Great to be here.
And so I think today's podcast is really interesting. Chris is a heart transplant recipient, actually multiple time heart transplant recipient. And I think also what I think is special about this is the small world aspect. I met your wife, Chris, at a meeting for Getinga. Paragonix is a Getinga company who makes all sorts of medical devices. And we were talking about what we did and found out that our company, who makes heart transplant preservation devices, was related to your experience in terms of being a heart transplant patient. So I'm certainly excited to hear a little bit more about your story and your experience. So to start with, you've had multiple heart transplants. Is that correct?
That's correct. It's common answer when someone asks a question about the heart transplant to say, which one? Which one are we talking about? There have been many. Total of 3, yes.
Yeah. So, and that's partly, when you get a heart transplant, when you first had your heart transplant, how old were you?
I was 17 for the first. This was back in 1992. And I feel like I had a really successful experience, a really great run. I don't remember the exact numbers, but I want to say the average donor heart at that time was, say, good for 12 years or so on average. And I had a 26-year run, I believe it
Right.
was. So, and minimal complications, minimal issues. So,
And this is a conversation that happens when you're faced with the prospect of a heart transplant is actually how long that heart might last,
yes.
because it's not necessarily going to last forever. In fact, on average, it's gone up over the years, but at the time it was about 12 years. It's gone up a little bit since then. But how is that conversation? Because I don't know that a patient going into it would realize that this heart isn't necessarily going to last the rest of your life.
I was thinking about that, and I don't recall, at 16, 17 years old, thinking about where I would be at 27, 28, when that might be a reality of, retransplant. At that time, it was just get the surgery done, get back to what was normal life. That portion wasn't on my mind, but it did eventually get there. And it's a heavy thought, when you're
Right.
doing the math, like, okay, I'm only a couple decades old and this thing's not gonna last till a normal death. And then, it's
Absolutely.
heavy.
I can't even imagine. Although I can resonate with that. At probably 16, 17, I wasn't thinking about what's going to happen to me
Right.
12, 15 years into the future.
It was definitely a different high school experience for me.
I can imagine. So leading up to your heart transplant, what was your diagnosis? What was your experience? Was it sudden, or was it
It
a
was
chronic experience?
pretty sudden. In fact, I didn't even know I had a heart problem until I went in for a pretty basic inguinal hernia repair, quick outpatient procedure. That, thank goodness I had a little bit of a complication in my recovery. It was slow to wake up from anesthesia. Heart rate was kind of off the charts. They kept me for observation. They did an echo the next day, and it was like, oh my gosh, why is your left ventricle as big as it is?
Right.
We got to get you checked out. And it was a pretty quick decline in the following months.
Right.
So the diagnosis was dilated cardiomyopathy with PJRT syndrome, which was a very specific electrical circuit problem I had.
Oh, wow. And so, which again, sort of incredibly heavy experience for the middle of high school.
Mhm.
And then you came to this point where it was obvious you were going to need a heart transplant. Can you remember what that conversation was like?
Yes, I was seeing a local cardiologist, and I was being medicated to treat my symptoms. I can't remember exactly how many drugs I was on, but not too many. But at the time, I was told no sports, no physical exertion.
Okay.
I was a freshman, sophomore in high school, so said, if you're planning on going to college, you'll want to focus on something that you could have a desk job
Hmm.
for the rest of your life because you're not going to stress this organ.
Right.
Um, the summer after my sophomore year, things had gone downhill pretty quick. Um, and it was fairly soon when the local doctor said you need to go see the specialists
Really.
at UCLA, and it was a very quick decision to get me listed for transplantation. So we went from getting learners permits, driver's licenses,
All the
winter
normal.
formal, that type of thing, to okay, we got to keep you alive, and now we're gonna open up your chest and swap organs.
Such a dichotomy of experiences there, going from standard high school teenager stuff to this moment. And then, do you remember the moment when your family got the call that there was going to be a heart donor?
Yes, very very vividly. Um, I remember that I was hanging out with some friends. One of my friends, his grandmother's house had a swimming pool. We'd go swim
Yeah.
at the pool. That night, I had asked if I could stay out till 12.
Yeah.
And my mom said, no, I want you home at 11
Yeah.
tonight. And I was very
Yeah.
grumpy about that.
As a teenager would be.
Came home on time, and we got the call about 11:06. It
Yeah.
was very, like, I walked in the door and the call came, and there were no cell phones
Yeah.
at that time, so the
Yeah.
house phone is ringing at a weird hour. I
Yeah.
answered it at the same time that I think my mom or dad did too. So there were two of us on the line, and they said, "This is whoever from UCLA. We have a heart for you."
Yeah.
And it was sort of a say that again, please, one more time. And we have a heart for you. You need to get down here
Immediately.
now, immediately. And okay, got it. I think I handed the call off to my parents just to get logistics of what entrance to come in and whatnot. And I immediately went in to pack up a quick bag and said a few prayers. And it was a very emotional and exciting time because I had been waiting anxiously for so long. At the time I was listed, they said, well, for your age, for your blood type, for your circumstances, you should expect to wait 4 to 6 months.
Yeah.
And I waited 13.
Oh,
So
wow.
after 6, 7, 8 months, I was kind of tapping my foot, 16, 17 years old, wanting to get on with life. Um, and was lagging and lagging. So when that call came, it was, yes, let's get moving.
Yeah, that's incredible. That's incredible. And so then you go in for surgery, you come out the other side. Um, uh, did you feel different? Could you
Absolutely,
tell right
immediately.
away?
I remember waking up. Um, I was still intubated, so I couldn't speak,
Yeah.
but I gestured, give me something to write with. And my mom was there, and they were asking, "How do you feel?" And I remember writing, "I feel great!" Exclamation point! Exclamation point! And one of the first things I felt was I was hungry.
Really?
Yeah, I was
Really interesting.
even all bandaged up and tubes everywhere and
Yeah, yeah.
things coming out of your rib cages
Yeah.
and all
Chest
that. I
drains,
was
everything
I
else.
felt, I mean, there's energy and life circulating through you that you didn't realize was missing for so
Yeah.
long.
Yeah.
And I felt hungry, and I felt good.
When I speak to transplant physicians and transplant surgeons about why they got into transplant, the moment you're describing is what most of them say.
Yep.
They say, they're doing these different rotations on surgery, different areas, and they get into a transplant rotation and they see this patient before and after surgery, and it's just transformative. They're immediately a different person, and not only is it obviously incredibly powerful for the person receiving, but I think it's important for you to know it's also meaningful. It can be life changing actually to some of the people that then go on to dedicate their life to transplantation to see that experience.
Yes, I have had that conversation with. So, not to get ahead of ourselves, but coming back to visit with some of the people that I've seen in ICU when I was ill, who didn't see me
Yeah.
come out on the other end. not knowing what happened to me, not knowing if I recovered,
Yeah.
not knowing if I had passed or
Yeah.
whatnot, and then to come back and see those folks on the floors, um, the amount of joy,
And
that they experience. Oh,
yeah.
I always wondered what happened to you. I'm
Yeah,
so
yeah,
glad to see
yeah.
you. It's so glad to see you doing well and up on your feet. And um, I know it's special.
Yeah.
Yeah,
And I think like for our whole team, um, we truly appreciate you coming in. It's helpful to know sort of why we do what we do. It's really really impactful to sort of see how transplant can affect so many people. And so I appreciate you sharing your story with us today.
it's my pleasure.
So then you feel transformed. You go back to life. You later become an engineer, right?
Yes.
Uh, Structural engineer.
Yes, I this
Yeah.
happened in the middle of high school. I did end up having to uh, what we call home studies
Yeah.
because I was immunosuppressed heavily.
Yeah.
Couldn't go back to be with my class on campus, but between home studies and a chemistry class at a local junior college to make up for a year of science credit, I still managed to graduate with my class.
Oh,
I did go back
fantastic.
to high school the second semester of my senior year, didn't
Yeah.
miss any time,
Oh,
graduated with my
incredible.
class with honors. I mean, um, and right, like I said, we had a really good luck with the first um, transplant. The match was great. Just a couple minor bouts of rejection coming out of the gate, and essentially smooth sailing. And I think being younger
Yeah.
uh, played a big part.
Yep.
But um, I don't remember the recovery being particularly prolonged or problematic. So back to school, apply to college, go to school, do the 4-year degree, and it was just a small hiccup in my teenage years.
Yeah. And so then you feel good. You go on with life. You start a career. Um, and then in terms of life as post transplant as a heart transplant recipient, um, you tell us a little bit about sort of what that experience is like. Is it do you feel limited, or did you feel like you could fully experience life?
At that time, went through engineering school, stayed on schedule, started my career, got my professional licenses. Um, it was as if nothing had happened.
Right.
And most people
Incredible.
that didn't know me going through that, when they find out that I had a heart transplant, they think I'm joking. No, come on, you're kidding. Let me see your scar. No, I've got scars. I got a lot of scars. Let me show you. Like, wow, I would never have guessed.
Yeah.
That's the line is I would have never have guessed unless you told me. I would have never have guessed.
Yeah.
And
I mean, I wouldn't have.
I said that's the best compliment I can
Yeah.
get because it is. I mean, it's not a minor surgery. It's not a minor um, adjustment to lifestyle to be a transplant patient. But
Yeah.
I was blessed with a great team and great match and a good recovery, and so I was able to do all the normal things. I met my wife at school. We got married, kids, we bought a house, we went on vacations. I snowboarding. I went was a hiker 2013, I believe. I climbed Mount Whitney, which is the highest
Nice.
peak in the continental U.S.
Yep.
So doing all the things that the average person would do.
Yeah. I
So
would say some things beyond what the average person would do. Those are some great experiences and
yeah,
accomplishments.
never considered myself an
Mhm.
athlete. Didn't play sports growing up, especially in high school because I
Yeah.
was dealing with the health issues. But um, the transplant, besides losing a little bit of time for while sick and then recovering from the surgery, in general, it did not drastically affect my life.
And it's just so amazing that everything you were able to do and experience and accomplish. And so it's such an incredible therapy to be able to like you described, have that experience and then go about a full and vibrant life
Yeah,
like that.
it's amazing. I hats off to all involved because it's mind boggling to think moving organs from one from a donor to a recipient and somehow
Yeah.
figured out how to make all this happen.
It's truly one of the most incredible feats of science, I think, and it's even beyond that, policy and logistics and everything to pull it off. But the impact is so profound.
Agreed.
So then going on from there, at some point you're starting to feel heart failure symptoms again. As you're approaching 26 years on your first heart.
There were a couple things. So my understanding is when they did transplants back in the 90s when I had my first heart, the way that they attached the donor organ to my body was different.
Hmm.
The graft spot was different. And so for me, I was having persistent rhythm problems. I
Okay.
had arrhythmias. I had several ablation
Yeah.
procedures because there was this conflict of who's gonna pace the
Yes.
heart. So the rhythm issues were sort of persistent. Also, with 26 years of caths
Yeah.
and angiograms
Biopsies.
and biopsies, that started to wear on my valves. So I
Hmm.
had a tricuspid valve regurgitation.
Hmm.
Also, unfortunately, as you know, one of the side effects of long-term immunosuppressive therapy is uh, transplant coronary artery disease. So,
Hmm.
narrowing and hardening of the arteries.
Hmm.
Um, allograft vasculopathy, I want to say
Yeah.
it's
Yeah.
called. Um,
Coronary allograft
yeah,
vascular.
CAV.
CAV.
So that was another one of my top issues. So um, the rhythm issues, I would be sitting at my desk at work, and my heart would flip into a different rhythm, and I'd start to get a little flushed and a little short of breath and a little sweaty, and check my heart rate and lay down for a little bit. And there was too many times excusing myself from the office to go home and lay down and take some magnesium or take some this or that. Sometimes having to go to the emergency room, sometimes having to go in for I can't remember the word.
A cath or a
No, the reset of the rhythm, the
oh,
cardioversion.
cardioversion.
Uh, so sometimes having to excuse myself from work, end up at the emergency room for a cardioversion. So those were happening too frequently, and I was having severe valve regurgitation. That
Yeah.
all of these symptoms were converging, and my team said we need to start talking about relisting
Hmm.
for retransplant.
Which, I mean, it's absolutely incredible to um, 26 years on a single heart
Right.
is an incredible experience, but it's your life. So, you want to be able to live it to the fullest. And so you get relisted. Tell us a little bit about, you're in a very different stage of life
Yes.
than when you were 16 and first going through this. How different was sort of the listing process and the process leading up to transplant uh, for you than when you were a teenager?
Well, so a few things. So in that 26 years, when I go in for clinic checkups, I'd ask my cardiologist. So yes, things are going fine right now. Labs look good, but we're coming up on X number of years. How long can I maybe expect this
Yeah.
to go on? Because I'm in my 30s, I'm in
Yeah.
my 40s, got a lot of life left, and
Yeah.
the answers was kind of always the same and kind of vague as well. Transplants have only been around for this number of years, and yes, we've got patients that have lived this number of years, but nobody. uh, It's impossible to say a patient can live 60 years with a
Yeah.
transplant because those people don't exist.
Hmm.
So it was always in the back of my mind that I'd need to be facing that.
Hmm.
Um, and at that point, I had lived more of my life with a transplanted heart than with my native heart. So I was starting to forget what it was like to not be a transplant patient.
Right.
I've always been medicated in some sense. I've
Mm.
always had some restrictions in some sense. Um, so it wasn't a matter of if, it was when.
Hmm. So at that point, you're preparing yourself for transplant. Can you tell me? do you remember this call for when a donor was identified, and what was that experience?
Yes. So I was listed in, say, August of 2018. And for a couple of years, I was focused on getting myself into the best shape possible for to be a transplant patient. I was told there was some study saying that for X number of pounds you lose, you could maybe shorten your wait time by X number of days or weeks. I was trying to get to my fighting weight
Yep.
and to be ready for to go through the recovery in the best shape possible. So I had been focusing on nutrition and diet and exercise as much as possible. And 2020 was the COVID year.
Yeah,
So everything was weird for everybody.
absolutely.
Um, and leading up to, the call came, it was the week before Christmas, 2020. And I remember that it was late in the evening. My wife and I were upstairs at our bathroom counters, brushing teeth, doing all that stuff. And the call came. And it had been a long day or leading up to Christmas.
Yeah.
And kids are home, gearing up for the big day, tired from the day, ready to go to bed. This is such and such. You need to get down to the emergency room for admission. We have a heart for you. Uh, Again, been waiting for this day, but in that exact moment, part of me said, "Oh, let's pass on this one. Can we maybe just if it was guaranteed that we could do it on January 5th, can we do that so we can get through the holidays, with the kids and all that? And it's late. I'm in my PJs, but I knew that this might
There's
be
no
there's no
guarantees.
guarantees. So, all right, on our way. Gather up some things, make a few phone calls. See you guys in a couple days, in the hospital, and um, off we were gone. Off we were to La Jolla.
Incredible, and that's you know, such a different description of that moment between when you were a kid to when you had kids and
Yes,
you were going
yes,
through it, and it's so vivid. And then you ended up going through actually two heart transplants during that process. But then when you finally recovered on the other side and got home, you seem that you're doing well. You was the recovery different at this time?
recovery was much different. Unfortunately, there was the transplant didn't take,
Yep.
which happens
Yep.
um, in cases, and I even after decades of luck with the first one, I got unlucky with the second, and so in the re-transplant, in that hospitalization time and correcting the issues that I had, there was some other complications. Um, there, I had some infections. I had some blood clots. I was on ECMO. I had other things that complicated my recovery. So, in the end, the heart, uh, the second heart of 2020 was a great match.
Hmm.
And the heart hasn't given me many problems, but I did have complications with uh, the other um, the other comorbidities.
Yes. Yes.
So rather than just taking my medications, getting my heart checked, I was also dealing with some kidney issues and some atrophy issues, some cognitive issues, and a laundry list of medical.
Okay. So that there was a lot more challenge getting through this
Yes.
time around. But at some point, do you start to feel better when you get home, or
It was much. It was about an entire year
okay?
between hospitalizations, follow up surgeries, rigorous rehabilitation centers, um, but in cardiac rehab, physical therapies, all the things. But so in a much longer time period, in the end, yes, I'm back to the point where I still have to tell people, yeah, seriously, I had not one, not two, but three heart transplants. Oh, I would never have known unless you told me.
Yeah.
So I'm back to that spot.
And it's your description here of your first transplant and eventually your third transplant, and the first year post recovery, it's really fascinating to me because my team, we do a lot of the medical research on outcomes, and what we see is reduction of these sort of postoperative complications, and it's so tangible. Sort of that experience is that, when we're looking at numbers and statistics, reductions in rehospitalizations and postoperative complications, use of ECMO, post transplant, you know, um, for us, and the medical scientists, it's certainly very positive. But to hear what that experience is, and the difference of experience between a very smooth postoperative course and a more challenging postoperative course, the real weight it places on patients, and I think it's inspiring to the work that we try to do here of making sure more and more patients can get that smoother postoperative course.
Yes.
And it's so critical because it is challenging, and the complications. You're right. Even today, with the best technology, there still are complications that happen post transplant, and it's still worth it at the end of the day. But it's the more we can do to reduce that, the better. I think the better off, particularly for patients, and who have to go through that and experience that.
Absolutely.
And so now, now having experienced two transplants at two very different stages of life, um, do you have anything that now that you wished or that you would share with either someone with the prospect of transplant, either as a young person or someone in the middle of the height of life?
Gosh, so many lessons. I think back to um, the first transplant in my teenage years. Before I returned to school, I did come back to visit and was part of an assembly. A couple other students, but I was I was the kid with the heart transplant, and
Yeah.
I gave a very short message. But I remember telling my classmates at the assembly, um, I remember we would go to PE. We would complain about having to run. We would complain about this and that, and complain about doing homework. And we have a lot of complaints. I said, but now on the other side, where I had physical restrictions. I was in recovery. I would have loved to be able to go to PE class and run. And
Yeah.
just remember, guys, it's not always fun, but be grateful that you've got these healthy bodies and
Yeah.
the ability to go out there and do these things, because those that can't would do anything to trade spots with you.
So
Um,
true.
and then now, as an adult with children, there's been so many lessons. I think um, for me, it's just really highlighted the importance of a support system,
Hmm.
supportive family, supportive friends and neighbors, just community in general. When things go wrong for a period of time and you really need to lean on people, it's it was almost shocking to me. The people that you didn't think would be there for you showed up.
Interesting.
Um, and also some of the people that you thought would be there for you didn't. Um, but um, I often, when I think about, maybe someday we'll relocate, we'll move out of state, we'll do this, we'll do that. Um, but I don't think that's on the table anymore, because I couldn't imagine leaving, being geographically separated from the network of people that helped carry me and my family through the difficult times. Um, so importance of community, importance of mindset, and um, if you decide that you're going to recover and get better, your chances of doing so are so much better, because it's very easy to say, you know what, woe is me. I'm just going to
Yeah.
sit and all these things have happened to me. I'm a victim. There's no hope, doom and gloom. Um, then you'll stay sick. But if you've got people encouraging you, if you've decided that we're going to make the best of it, and this is a bummer this had to happen, but we're going to learn from it, we're going to grow from it, we're going to come out stronger. Um, your mindset is absolutely critical.
Absolutely. Can I ask you if in terms of advice to not potential transplant recipients, but to that community, um, if you have someone in your life that if somebody has someone in their life that is potentially facing a heart transplant or going through a heart transplant, or any transplant, is there any advice you would give to them about what really matters? I think a lot of people sometimes when they see a friend in a tough situation, it's hard to know what to do.
Right.
Do you have any advice about how to help most and what's impactful when you say to show up?
Don't wait to be asked, because on from my perspective, you're lost. You don't quite know what to ask for, what kind of help you might need, what will help, what will resonate with you, what kind of words of encouragement you might need or you might reject. Um, you've got enough on your plate
Yeah,
that you can't say, you know what, I'm going to call this person and I'm going to ask them to do this or bring food or
yeah.
do this help.
You're not in the place to project manage
Yeah,
this.
don't put that on me. So if you're inclined, if you care about someone and if you're inclined to help, um, just show up.
Just show up.
Um, don't say, "If there's anything you need, you just let me know,"
Yeah.
because now that's my project to now think about how can I bring this person in. Just knock on the door, call, just say hello, check in, let them know they're supported. Um, my wife, we're very involved in the Greek community, and everybody cooks, everybody brings food, and that solves a lot of problems. So I'd say as the supporter, do your best to be proactive and let them turn you away at the door as opposed to waiting for them to call and say, please come over.
That's fantastic advice, and I think um, it's probably not specific to transplant, but to a lot of aspects of
Sure.
life when you know someone who's going through
It
something
means a
challenging.
lot. Even if you don't, even if the patient doesn't utilize you at that time, just to know this person made an effort, is right here, food in hand, ready to do whatever I need. Um, that that means a lot.
Absolutely. And so now you're doing well. What is next for you? Do you have any goals or anything that particularly in life that you want to do next? Now that you are where you are.
I'm really enjoying my full time uh, dad of college kids role, and my it's funny. I was reviewing my tax return that
Yep.
our CPA prepared last year. And normally, when I fill out paperwork and I have to say my employment status, I either say I'm retired or I'm disabled, depending
Yeah.
on what the paperwork is. Um, but on my tax return last year, I was listed as homemaker, which it's not inaccurate.
Yep.
It's just
Yeah.
I never considered myself a homemaker, but my wife, she works very hard in her career, and I try to take most of the responsibility for keeping the house running, keeping the fridge stocked, keeping the groceries in, maintaining the cars, shuttling supplies to my kid who's in college locally, um, just taking those that busy work stuff off of her plate. Um, as for goals, uh, stay healthy and active as long as possible. I spend a lot of time trying to take care of myself and keep myself in good shape so that this heart I'll get as many years out of this heart as I can.
Absolutely.
Um, really enjoying family. Looking forward to more travel with my
Mhm.
wife and with my kids before they all graduate and start their careers, and time with them becomes less available.
Yeah.
Um, I, I have a few things kind of on a bucket list, but I'm not going to share them.
No, no worries. No
But
worries.
honestly, with everything that I've been through and my family has been through, just to be here today to do the little things is I'm so grateful for it. So I feel so fortunate to even be here to even have this conversation with you. Every day is a blessing, and I've to put it bluntly, I lived longer than I thought I would, given
Yeah.
everything I've been through. So I'm very happy.
Well, I'm incredibly happy and grateful that you're here today and that you're willing to share your story. It's truly inspiring, again, towards what we do. Plus, I may ask you afterwards about being the parent of college age kids because I have a high school age kid right now, and that's close to my horizon is
Yep.
my kids
Yep.
getting to that age. But um, truly, thank you for making the time today and sharing your story. At the end of the day, it's people like yourself is why we do what we do, and I wish you the best on your transplant journey.
Thank you. It's been a pleasure.